As we look back at the pandemic 5 years later, we're still monitoring the symptoms of long COVID. Close to 7% of adults who got COVID-19 in the U.S. experienced long COVID symptoms. Mercy Health Family Medicine physician in Boardman, Dr. Stephen Predebon, is here now to break down some of those symptoms and the chronic conditions that people could be dealing with. Doctor, thank you for your time.
Thanks for having me. I'm happy to be here.
Yeah, what are the most important main symptoms that you're seeing in terms of long COVID among local patients?
I think the most important ones are anything that comes along with inhibiting your respiratory status if you're having any extra breathing problems, especially if you have COPD or other long-term breathing issues at baseline. I think what we see more commonly, though, is things that aren't necessarily quite as severe, but much more prevalent, like fatigue, brain fog, even sometimes mood gets affected with it.
And I've heard even hair loss. You hear it at the hair salon, people talking about people who say they have long COVID. Is that a typical symptom too?
Yeah, and some other things that might not be is physically limiting, but definitely bothersome. Hair loss. I think we probably all know someone who went through COVID and lost their smell either for a short period of time and very rarely permanently, but yeah, some things that are bothersome, but maybe not as physically limiting too.
Oh, yes. Now, how much can the symptoms have a lasting impact on someone's health?
It's really variable. Most people who get COVID are going to recover in that 1 month time frame. You hit that 3 month mark, and that's whenever we start to classify it as a long COVID syndrome. And, that can last anywhere from months to years. I've had some patients dealing with some of these symptoms. Typically, it's not common for it to last that long, and by and large, most of these cases are going to resolve at some point, but it can be a very long time.
5 years later, how much do you believe the COVID-19 vaccine is necessary for certain age groups? Who would you recommend definitely get the shot?
I would definitely recommend people who are older, immunocompromised, have longer heart conditions. But I think even more importantly than that is just kind of having the discussion with your primary care doctor. Let them know what your concerns are, let them know about your chronic illnesses, and kind of coming up with a personalized plan is the most important thing. But if you want to target, kind of make a broad-based statement on groups, it would be those older folks or people with chronic lung problems.
What does treatment for long COVID patients entail? And are doctors finding maybe new medications or methods to treat long COVID symptoms?
So it's variable because of how the symptoms are, and we really don't have a medicine that says this is going to cure your long COVID at this point. The best thing to do now is do your best to prevent it. So take care of yourself at baseline. And if you are at those at-risk groups, talk to your doctor about getting a vaccine. You can manage the symptoms. So if headache is one of those, there's medicines we can use for headache, or if you're having breathing problems, we might need to adjust your inhalers or put you on steroids, but you kind of have to take it. We're really managing symptoms. We don't have a cure at this point.
Got it. And are some people more predisposed to COVID complications than others, would you say?
People who do get that acute infection more severely, those people who are needing oxygen from it or who wind up hospitalized from it, are a little bit more likely to, or they're higher risk to be long COVID, and some of those other people we've already mentioned so far, people who have lung problems at baseline, the elderly, or someone who's immunocompromised probably has a higher shot of getting long COVID.
All right, important information to keep in mind, especially as we move throughout the rest of this year. 5 years later, can't believe it. Doctor, thank you so much for being here.
Thanks for having me.